Welcome back. With me I have Patty Hunt. As a pediatrician, we take care of very sick children at the Pediatric Diagnostic Center, children who you really wonder how a parent could possibly take care of them. A teenage mother leaving a neonatal intensive care unit where a child had been for 2 months or 3 months, who's covered with monitors and difficult feeding and really just a difficult look about them. And so we turn to people like Patty Hunt. And Patty has brought in how many children over the years?
72.
72 children. So Patty got one of these awards as well from Kids and Families Together because they recognize what it takes to be a foster parent and provide, sometimes it's just breathing room for a family. How did you get drawn to this, Patty?
I just wanted to help babies. That was my big thing. I love infants, and so I hooked up with a foster care system and just started gradually taking on more and more drug-addicted babies, and now I just love it. I love taking them from that really fragile state into being human beings.
Yeah, it's hard because we've talked about fetal alcohol spectrum disorder before, and so these kids have been kind of swimming through a toxic soup during pregnancy. They're coming out to a home that may not be very supportive, and the effect on the brain in terms of stress for this mother who is already self-medicating perhaps for her own depression, and certainly afterwards moms are oftentimes depressed. What are these children like for you? I mean, how do you find the emotional serenity to handle a baby with a shrill cry that will raise the hair off the back of your neck?
You just have to take a deep breath and just learn how to stay calm, because if you stay calm, you can help that baby to stay calm. But we learn techniques of wrapping them up, swaying with them, just swaddling them up, keeping them calm, basically, and not making their environment too overtaxing for them.
Oftentimes I'll have 3 generations. I've got grandma shaking mom, and mom shaking the baby's so nervous, but these babies are wired a little bit differently, and then they spend time in the hospital too. They oftentimes are returning with their gastroesophageal reflux. And how many babies have you had at a time in your house?
Well, when I was younger and my kids were home, we'd have 2 and 3. Now that it's my husband and myself, we take 1 at a time.
I would say that's the way most of us try to take the days when you have a foster care.
You have to, just 1 day at a time.
And so how do you ground yourself? Because it's a very intensive kind of thing. Even getting them to eat can be really difficult.
It can. The foster care system has lots of support stuff out there. We have the mentor program. I'm one of the mentors. The association, we have a foster parent association, and we can get together and we'll hook you up with people to help you when you need stuff. And all of us need to take a break once in a while. You have to with this kind of a job, and so teaching you how to recognize that and take that break. For me, I go hide out over at Catalina Island for the weekend and just relax. But just loving what you do helps. You know, you love being a doctor and taking care of the infants that way, and I love taking them into my home and taking care of them that way.
I think in terms of serenity, having a baby in your arms is a very wonderful kind of thing. How about, these are oftentimes children who are in the foster care system, and in Ventura County we work really hard on reunifying parents, on providing with services to get over their depression or help them through their drug addiction and go on to lead lives. Of your 72 foster children, and I know you're too busy to get your award, you're back at a convention with other families, really as a kind of a national role model. Where are all your 72 children now?
I have a few of them that I know where they are, that I'm now their godparent, so I get to see them all the time. And other of them, if they've gone to family or gone back to birth parents, I don't always get to know where they are and what they're doing because they want to leave that part of their life alone. But I have quite a few godchildren in this county that I keep track of and know where they all are, and it's just rewarding to see that really screaming infant is now, 5, 6, 7, 8 years old and doing great in school.
Well, tell me more about the mentoring program. Do you act as a mentor now yourself after 72?
Yes, I am a mentor. I have approximately 20 other foster parents right now that I mentor, and they can call me up, ask me questions. We help them know what resources to go to and where to get them.
Tell me a little bit more about the mentoring program. I know you teach, and how many parents do you mentor?
I have 20 mentees right now, and they're range from foster parents to relative caregivers. We help answer questions, lead them in the right direction, tell them who to get in touch with when they need to, if they need tri-counties, how to do that, which doctor's offices are the best to go with what needs they have, those kind of things, questions that you just can't teach until you actually have a placement.
Well, what a tremendous service you've given. I know Why Kids and Families Together has honored you, and thank you so much for joining us today. Ventura, we'll be right back. We're going to talk about some of the causes of children ending up in foster care and what we're doing to prevent them.